Good morning. My name is Dr. Symprosa Tindi. I'm a medical doctor and a public health professional, having worked as a health systems manager at Nairobi Women's Hospital, but also as a leader in other health facilities, leading health teams. My topic was a review of the COVID-19 pandemic I picked a health facility, which is the Kihara Level 4 health facility that is located in Kiambu, and that is close to Nairobi, similar to where I was working before, so that it can at least give a picture, and it has a bed capacity of 84. The reason why I picked this topic is because if you look at what was happening before, the COVID-19 pandemic caught us unprepared as health facilities, and most people were unaware that it can actually affect us, and they thought it was only for foreigners. So this was to review the current hospital-19 pandemic preparedness and experience and the leadership and lessons learned from before, so that we can prepare for future ones. When I was working at this health facility, we got a patient who had COVID. Most of us were not aware. Initially, we suspected, did the test, but it came back negative. So people relaxed. And then when she was sent to the wards, there were about 29 health service providers who, including myself, who actually came into contact with her. So that means that we had to be quarantined, and it more or less stopped the activities at the hospital. Now, if you look at the picture that we had, we actually thought that we were going to end up getting the virus, and therefore, as a result, we would not be able to function. But having had it on the 12th of March, 2020, which was just soon afterwards, the first couple that actually had it, who are standing with the CS right now, were healed. So that means there was hope. Now, if you look at for this particular survey, I used a questionnaire, and that was with 5 key thematic areas. That's clinical, communication, environmental, which is looking at IPC measures, human resource, looking at actually the health service providers, and general preparedness, especially looking at the procurement. Most of the staff felt that they were not prepared for COVID-19 because they had dropped the ball since it was over, and that the emergency teams that they were working on now was for the cholera outbreak and not necessarily COVID. They were using a multi-sectorial team without having done any risk analysis on COVID. And there was no isolation area that they had at that particular time. And even now, during, if ever they were to get a COVID patient, the ICU facility that they were using was Tigoni level 5, and that's where they were referring to. And they felt that they do not have enough staff at the moment to carry out COVID-19 management, because most of the staff had left, and those who are left were actually not well prepared. When it came to vaccination, it was ongoing on an ad hoc basis, but then that is using the MCH, which is where they were using for also other vaccines. So if you review that and you review the previous gains that were made, you find that the lessons right now are that we are still not prepared for COVID-19. We have actually dropped the ball. And this has been with the assumption that it's not there anymore. And if you look, just move to the next slide. If you look at from the responses, we will still end up using the limited resources again. And we will still end up working in panic mode. So that means the key areas that we discussed in the questionnaires have not really been touched. And that means that we need to start working on the shortcomings of the pandemic. So my ask is that at least, if this is the ideal situation that we'd like to have, at least an ICU for most of this, even if it's level 4 health facility, and also an isolation center for at least these facilities. But are we really ready for that? If we move to the next slide. So that means that the development partners would actually help us from this small survey to see if there's funding for training of the hospital staff. Because from my findings, the hospital staff are new. So that means they really don't know in terms of preparedness what it is. And the ones that they are trained, it looks like they were sending to other people. So training personnel needs to be increased so they can increase the knowledge. Emergency training needs to be at least set in so they can be prepared for emergencies and pandemic preparedness, and also aligning their resources or channeling where they get their resources so they can use a collaborative method to actually work with the resources that they have and also a multi-sectorial approach. Use also champions to spearhead the teams. And of course, when they are doing that, they work very closely with the Ministry of Health to actually develop sustainable programs, because you can see already that after COVID was over, that is it. That was that period for COVID. So that means even now, if we were to get another one, we would not be able to manage the way we had thought we would. And also to look for a retention strategy to actually retain skilled health personnel who can help them within a very short time in case they get another pandemic. We had Marburg virus in Tanzania. We had Ebola just the other day in Uganda. So we don't know what would happen with Kenya. And that means that we have to actually be prepared regardless of what happens. Thank you very much. And I hope with this short presentation, it sheds light on what it is that we need to be doing in terms of moving forward for preparedness for pandemics and epidemics. Thank you very much.